Thank you, Madam President. Madam President, I come to the floor today on the 6-month anniversary of the signing into law of what is commonly across the country known to be called Obamacare. It is, and I come as a physician, someone who has practiced medicine in Wyoming for, since the early 1980s, taking care of thousands and thousands of patients across the Cowboy State, their families. And I come and bring that experience to the Senate floor, and I have a doctor's second opinion. Now here we are 6 months out, like looking at an x-ray after something has happened and going 6 months later and taking a look at the x-ray and seeing what has really occurred to the patient. Well, I will tell you, Madam President, that when 6 months ago President Obama signed his new health care bill into law, he said, quote, "All of the overheated rhetoric over reform will finally confront the reality of reform." So here we are 6 months later. The American people have been confronted with the reality of the president's reform, and they don't like it. The American people who listen to Speaker Pelosi say, first we must pass the bill before you get to find out what's in it, now have learned more and more what's in it, and they don't like it. The American people watched as this body came together, cobbled together legislation with things like the Cornhusker kickback and special treats for different senators so they would agree to vote for the bill, and the American people don't like it. As a matter of fact, Madam President, there was a Rasmussen poll that just came out Monday, and as of Monday of this week, 6 months after the bill was signed into law, 61% of the American people want Washington to repeal this new health care law. 61% want it repealed. Once again, instead of listening to the American people, the president continues to try to sell his law. Tried it again yesterday in a backyard. And he continues to make promises that he knows that he can't keep and have not been kept with this new law. Now that we're 6 months into the new law, I'd like to walk you through some of the president's promises and the reality that the people of this great country are living with as they look at what has been crammed down their throats. Promise number one by the president: if you like your current health care coverage, you can keep it. Well, according to a new Obama administration regulation, this is the president's own administration writing the regulation, a majority of Americans who get their insurance through work will not be able to keep the current health care plan they have. Even the White House admits it. The president keeps saying it, but the White House admits it's not true. Promise number two: the law will bring the cost of medical care down and reduce the deficit. Well, the Congressional Budget Office disagrees, saying that it erases savings. The actuary at the Center for Medicare and Medicaid Services says the new law will increase health care spending. Let's look at promise number three. This says the law will strengthen Medicare. Well, it actually cuts Medicare by $500 billion. $500 billion cut from Medicare. The seniors of this country are furious. Now, to make matters worse, Madam President, this money is not being used to save Medicare or to strengthen Medicare. The money is being used to start a whole new government program for other people. There is a rebellion, the seniors of this country, Madam President. Let's look at another promise that the president made. He said the law will create jobs. We have 9.6% unemployment in this country. Well, we continue to learn about companies who want to employ people, who want to create jobs. But instead, those companies are cutting their payrolls in order to deal with the massive new tax increases included in the law. And if you look at the incentives that are given to small companies in terms of helping them with health care costs, the incentives are the ones that say if you really want to get something, you want to cut the number of employees you have and cut the salaries of the people who you're still going to employ. Madam President, that does not create jobs, and this law does not create jobs. And then, of course, President Obama also promised that the federal government would not ration care. Then I would say, why did the president make a recess appointment of a man to run the Centers for Medicare and Medicaid, who has repeatedly acknowledged and said that the government must ration care? He has a long history, but he didn't come to the Senate to explain a number of statements that he's made about redistributing wealth, rationing care. And he doesn't need to explain it to the Senate. He needs to explain it to the people of this country. So that's Donald Berwick, physician from Massachusetts, still refusing to testify before Congress and the American people. And he has been invited again to come today. And there will be people waiting in a room that he has been invited to, and we will see if he does arrive, but I doubt it. So, you wonder why Americans are sick and tired of Washington? It's no surprise. Yesterday, when speaking at the event in Virginia, the president focused on provisions of the new law that go into effect today. Well, as Paul Harvey used to say, now the rest of the story. Some of the changes that the president touted yesterday, they actually don't start right away. Many Americans won't see how these changes will impact them until after January 1st of 2011. But yesterday, USA Today, the newspaper, actually ran a big story, a full-page story almost, on the new provisions. And the thing that was so interesting about the story, Madam President, is that the story outlined the basics of each provision, and a little thing there, and then underneath each one of the basics, it had several paragraphs of things that they called be aware. You know, the basics are this, but be aware that this may happen to you, and this may happen to you, and this may not apply, or this may apply. All of those things to alert the American people that there's a lot more to it when you look at this over 2,000-page bill, and there's so many agencies that are being brought forth to write rules and regulations. So many things that the American people will still learn more about this bill. And as they learn those things, Madam President, they will like it even less. So the story outlined the basics and then the be awares of each provision. So I think it's very important for the Americans who are listening and who are focused on this to be aware of these be awares, that they're so much longer than the provision. So what I would like to do is just walk through some of them with you, Madam President. And first, the law does allow young adults to stay on or be added to their parents' health insurance plan until age 26. That's what we hear. Make sure to read the fine print. Now, one of the things that the Obama administration published was a so-called grandfather regulation, not when the bill was signed into law, but in June. This Washington White House regulation defines the rules that employers must follow if they want the health coverage that they currently offer their employees to be exempt from the new law's mandates. So it says, be aware that children are not eligible to be added to their parents' grandfathered employer group plan if the child can access coverage in other ways, if they have a job, and another very, very complicated situation of rules and regulations. Second, the law now requires insurers to cover more preventive services, mammograms, colonoscopies, immunizations. It's important, Madam President, for people to take responsibility for their health. And things like screening mammograms and colonoscopies, immunizations, those help. Those help people in the long run. It says the insurers can't charge co-payments, co-insurance, or deductibles for these added benefits. Then let's get to the be aware section. Be aware, it said, that these cost savings only apply to new health insurance plans, not the so-called grandfathered plans. So you have them describing the grandfathered plans and then who can be a part of it and who can't. There is more to this than meets the eye. So also be aware, don't be surprised if you see your insurance premiums go up. The president wants to sell Americans on the good things in the law, what he considers the good things in the law, but he's failed to mention that mandating insurers to cover these extra benefits is going to cause premiums to go up. Now, insurance companies can no longer cap the amount that they'll pay over a person's lifetime. Americans need to be aware, however, that insurance plans that had lower premium costs because, and you say, how do you get premiums down? They did it by limiting lifetime amounts. It says those people now may be forced to pay higher insurance premiums. The law designed new rules preventing insurers from denying coverage to any child under the age of 19 who has a pre-existing medical condition. So what did the Washington Post say about that? What did the Los Angeles Times report? Well, they both printed articles, Madam President, this Tuesday, 2 days ago, warning consumers that major health insurance companies, what are they going to do about this? They're going to plan to stop selling new child-only coverage products completely. So is this going to help kids with pre-existing conditions, this law? Well, as these insurance companies plan to stop selling new child-only coverage products, that's not going to help, Madam President, and it's because of this law. The health care law allows parents to wait until their child is sick before buying a policy. When only sick people buy health insurance, premiums have to go up. As the rate increases, more people drop their coverage. This certainly is going to hit lower-income families hard. Some uninsured parents, while they can't afford family insurance, often decide to buy a child-only policy to ensure their kids have coverage. But according to these new reports, families all across America will have fewer health insurance options because of the new law. Fewer options for families, fewer options for patients, not more. Madam President, this Congress had a historic opportunity to make patient-centered health care reforms to bring down the cost of medical care in this country. We had a historic opportunity, and this Congress missed it. The one thing the American people wanted out of health care reform was lower costs. But increased Washington mandates passed by this Senate only serve to produce fewer insurance choices, increase costs, and insert the federal government between patients and their doctors. It is time that we start talking honestly about how this law, even the things that Republicans and Democrats agree on, how this law affected patients and their families. That's why I believe this health care law needs to be repealed. It should be repealed and replaced with better ideas. And there are better ideas, Madam President, better ideas that were rejected by the majority in this Senate who refused to listen to the American people who were bringing forth better ideas. Changes like allowing people to buy insurance across state lines. That's going to get down the cost of care, and it's going to help about 12 million people who didn't have insurance get insurance. Offering premium breaks to folks that make healthy lifestyle changes, absolutely critical. Dealing with lawsuit abuse to help eliminate some of all of this defensive medicine and the increased costs of that practice. We need to allow small businesses to join together, to pool together in order to offer affordable health insurance to their workers, get better deals with insurance costs. These are changes that put patients in control of their medical decisions, not the government. People ask me as a doctor what I think about this law. I'll tell you, having practiced medicine for over 25 years, we need to do something. This wasn't it. This law is bad for people. It's bad for people who are patients. It's bad for people who are providers, the nurses and the doctors who take care of the patients. And it's bad for payers, the taxpayers of this country who will foot a significant amount of the people who get their insurance through work, what the impact is going to be on those jobs and those businesses. This is a bill that is bad for people. We can and we must fix a broken healthcare system, but we can do it without undermining choice, which is what this healthcare law has done, without undermining competition, which is what this healthcare law has done, and without undermining innovation. And this is what this health care law has done. And we need to do it without raiding Medicare, to start a whole new government entitlement program. We can do it without raising taxes that kill jobs in a bad economy. And that's why, Madam President, as we are here today, 6 months after the enactment of this bill becoming a law, the Obamacare law, 6 months later, 61% of the American people want it repealed. It is still time, and it is now time to repeal and replace this health care legislation and replace it with something that will work for the American people, because that is what this country wants, that is what this country needs, that is what this country and the people of this country have been asking for all along, but the members of the majority and the White House refused to listen. Thank you, Madam President.